Welcome, everyone. We're going to convene the Insurance Fund Working Group. Today is Monday, December 9th, 2024. Any opening remarks? Great. We will move on to a review of the agency responses to the Insurance Fund Working Group questions. And if everyone should have a printout in front of them, the Department of Mental Health and Addictions. We good? Okay. Put their response in here. The question was to provide a summary of what services are funded through the insurance fund. And there's $451,000, and it allocates 2 contracts to 2 non-state entities, Bridges Health Inc. in Milford and Youth Continuum Inc. in New Haven. And these are used to support 2 of the state's 4 access centers for young adults, which provides a physical location for young adults to go to access mental health and related resources. And it is anticipated that these services are needed going forward. Any questions or comments? The next one was the behavioral health advocate. The note from OPM was that this position was put out on September 5th and closed on October 4th, and no staff have been hired yet. Department of Aging and Disability Services. Questions from myself are: 1, what does the fall prevention program do throughout the year? And it looks like it does. The response was that it is a research-based balanced training regimen that is administered by the Connecticut Community Care at 18 community sites. It is designed for older adults at risk of falling, and the program centers on body movement to improve stability, posture, coordination, walking in a range of motions. There's a lot other stuff in here. I'll move down to the second question. How many people? There's over 300 participants per year. How many staff are employed? 1 primary ADS staff member. And another question: what does multiple program ready to be deployed mean? In addition to continuing to provide Tai Chi Quan, moving for better balance, ADS has scheduled the first trainings of steps to safety and drafted an RFP to identify at least 2 community providers to implement innovative fall prevention programs beginning in FY26. The question was, why is this an insurance assessment? And the response was that it would prevent falls, especially with those users in the Medicaid program. And there's some background information. How was this funded prior to being an assessment? And the legislature did fund this through the general fund in FY 208 and 209. And then in 2010, it was moved as an assessment. There was a question from Sue Halpin in the 2023-24 budget, allocated a total of $382,660 from the insurance fund to a line item for fall prevention. Please provide a summary of what services are funded. And there's some additional information there. There's a $50,000 to provide Tai Chi Quan. Is this anticipated that the service is needed going forward? And the response was generally yes, to prevent falls. Next question was related. Oh, sure.
This isn't really a question, but I thought this was an interesting discussion on the fall prevention. But I was just wondering, and this isn't a question that anyone here can answer, what are the metrics to determine whether it's successful? So how do you know that there are decreased frequency of people falling because of the, I would say, training that they're going through? And I don't know the answer to that, but it would be interesting to know, is there a way to measure success there? And it's really I know it sounds like a question, it's more of a comment, because I know that none of us can really answer it.
Any other questions or comments? Senator Austin?
Um,
There you go.
Thanks. So one of my concerns or questions back to, based on the responses here is what areas of the state is this most prevalent being taught in? Is it only in certain areas of the state? It says it's statewide, but where is it being, taught and how's it being, used? Along with the metrics that Eric talked a bit about. I'd like to understand a little bit more about that. So,
Ally, please just take those notes down. Okay, we will move on to the Department of Housing. Please provide a summary of what services are funded by this line item. Identify any non-state entities who receive funding to provide the associated services and how much the entity receives. So in accordance with section 8-444 of the Connecticut General Statutes, this line item is used to exclusively fund one position, a special homeowner advocate within the Department of Housing, including salary and fringe benefits. Is it anticipated that the service is needed going forward? And the response is, it is anticipated that this position will continue to have a role related to crumbling foundations for as long as the problem exists. And it is anticipated to take another 20 to 25 years to resolve. Any questions? Senator Austin?
actually, I don't have any questions. I actually sit on I'm a ex officio on the CIFSIC board. And this program has gotten people back into their homes. It's been very successful in addressing the issues of crumbling foundations, but it's also brought the municipalities that are impacted, have been able to keep people in their homes or get people back into their homes, depending on how bad the situation was. It's really made a great difference in the in the problem that we had and the legislation that we have put in to stem this from happening again is also something that has been helpful. And we do see an end in sight in this problem, which I think is also helpful to know when you're having an assessment that it's not an ongoing assessment. And while it may take another 20 years, I'm not thinking that it's going to go much beyond that. It really is something that we have looked at. And we've also looked at the federal government to address the issues, to see if they would be partners in this. I'm not certain that that's something that we've been able to accomplish, but that is something that we're looking at. Thank you.
Thank you, Senator. Do you mind if I ask you a question if you sit on the board? Because so the special homeowner advocate, is this solely related to CIFSIC?
We don't really deal with the special homeowner advocate on the CIFSIC board. We deal with with CIFSIC itself and the people that are associated with that. The board oversees what CIFSIC is doing, and they have actually contained the costs of, even though costs have increased, they've contained the costs of fixing those foundations. I think the homeowner advocate does more than just CIFSIC. I am thinking that they were doing the Sinking Homes fund that we had in policy and two or three others, but as they don't report to the CIFSIC board at all, this person does not come to any of the meetings or is not somebody that we interface with.
Okay, so that's really interesting to me because the answer here was that it is anticipated that this role will need to continue related to crumbling foundations, yet they don't participate in the board. So,
No.
All right, moving on to Department of Administrative. Did you guys have a question over there?
Not a question, but 8-444 does lay out specifically the
Turn on your mic.
It does, 8-444 does lay out the specific obligations of this position. So if you take a peek at that, it'll give you exactly what it is, what this person is responsible for.
Thank you.
Mhm.
Chris?
Thank you. And as a former incorporator of CIVSIC, I understand the need for the captive insurance company for certain. I would just say for this particular position, because it does have different activities for what we're looking at here today, I'd be curious how often they're actually dealing with insurance issues themselves as a special home care advocate, or are they dealing with other things that should probably be dealt with from the general fund or something else as a funding source rather than the insurance fund for it. But I guess that's a,
Yeah, Jane, can you answer that? Are you, is the Department of Insurance dealing with the special homeowner advocate?
We do not.
Thank you. Any other questions? Eric?
I think this sort of begs the question that we should probably find out who the special homeowner advocate works most closely with. If it's not the CIFSIC board, if it's not DOI, well, who are they working with?
Ally, you have that question? Thank you. All right, moving on to DAS. The 2023-2024 budget allocated a total of 1.9 million from the insurance fund to DAS. And really the response here is that there are 8 positions. We were given a chart, and this is related to supporting IT at the Department of Insurance. And that's what that line item is for. Any questions or comments on that?
It's IT and HR, both the two different consolidated efforts that used to be assigned to agencies and are now assigned to DAS as a consolidated effort. So we'll see that across the board with all of them. So just wanted to.
Yep, thank you. Moving on to the Department of Public Health, there's a lot of information here because we did ask about the different line items on the insurance front. There's AIDS services, children's health initiatives, CT medical home initiative, reproductive health support program, sickle cell disease, Connecticut asthma program, child sexual abuse program, lead poisoning treatment, breast and cervical detention and treatment. So we did get a lot of information additional responses for X-ray screening and tuberculosis care, needle and syringe exchange program, venereal disease control. So that was broken down by DPH with an explanation of what each of those programs does. And do we have any questions or comments? Sue?
Good morning. First, I'd like to thank the chairs and all of the agencies for their really in-depth responses to these questions, because I think it's the first time we've really seen something like this that goes into, excuse me, great detail on what the funds are being used for. So I want to thank everybody who contributed to this. I also would love to see there was a question asked on one of the questions earlier that I would love to see expanded to all of the answers, which is where were these programs funded prior to being funded in the insurance fund? And I think I know the answer for the Department of Public Health funds in that they were funded in the general fund until a certain period. I think it's also important to point out that these programs under the Department of Public Health are only assessed on health carriers and therefore policyholders, separate and aside from some of the other programs that we've talked about and are having answered. So I would love to have that question for posterity answered in the document, and whatever documents we end up with in terms of a report. Just so that we have that for future reference. And then just one comment before you move on, I think to your last agency, which is OHS. I think it is hard to argue with, perhaps the good work that's being done under all of these line items, right? They all seem to have merit. I would also lend support to what Eric asked. Has anybody looked at outcomes recently? I think that's a very fair question for all of these, but it also begs the question, I think, when you look at these more closely, of do they really belong in the insurance fund versus the general fund? And for this section alone, it's about $12.7 million if you exempt out the immunization fund, which again, I want to say for the record, we don't have an issue with from the health carriers. But I think it's important to reflect that as we move forward. And again, just want to thank everybody for their diligence in getting this information and responding to this information.
And thank you, Susan. I also on one of the most recently, I asked the Office of Fiscal Analysis to give us a report on how much was funded, what programs were funded under the general fund, and before we moved most of them over in around 2015, 2016, give or take. And what would it cost to in today's dollars to move it back? And is there a way that we could start looking at this as a process and not as a all or nothing approach? Because the general fund is going to have its own complications. Now, we're not going to have dollars that are not already obligated and not a lot of unexpended dollars in the general fund. But I think that we have to start looking at moving some of this back towards the general fund. And one of the suggestions in talking with the chair is to move it back over, say, a 5-year time frame, so that we're not doing it all at once, to think about it in a process. Now, I know that we're going to eventually come up with some recommendations, and I'm hoping we come up with those recommendations this month to look at an ability to move some of that back. So I'm hoping to get the information from OFA this week so that we could start paying attention to what are we trying to do here. And relative to the healthcare policies, this piece here, which is $12 million, it doesn't go on every healthcare policy, is my understanding. It goes on a small number of healthcare policies, and I think we have to pay attention to that too. So I'd like to have an idea on how many healthcare policies are there in the state of Connecticut? And of those, how many are participating in dollars to the insurance fund? And what are the lives that are impacted there? So it would be a 3-part question. How many healthcare policies are there? Of those healthcare policies, how many are mandated to participate in assessments to the insurance fund? And how many people are associated with that? So is it a family of 6 or a family of 2 or a single person? So that we can have an idea on when we're doing assessments. I think a lot of people think that the assessments are for every person in Connecticut to participate in, and that is just not the case. So I think that that's something that if we could get those answers, and maybe sometime between Christmas and New Year's, if we have time, come back and come up with recommendations that would be parsed out for consideration next year, because a task force can't mandate anything. Alls we can do is say, hey, listen, we've looked at this. We've got a lot of data here. We think that we're going in the right direction. We would like you to consider doing X, Y, or Z. But I would like to come up with those numbers too. So I don't know if the insurance department can give us answers to any of those questions.
So we can give you answers to some of them. I think we'll have to work with Susan to get all three parts.
Yeah.
But we can work together on that.
That would be very helpful because I think that we need to sort of globally think about that.
Yep. And you're right. It is the number of Connecticut residents who are insured. It is a smaller number.
So, you know, is this something that we could do with the state employee system? Is that part of the, of this or not? And it's just a question that I have that I just, because it's a large number of people, a large number of policies and a large number of people that are in there, and just to, it's sort of something that we can actually talk about because we're funding that system. So I think it's something that we should pay attention to broadly.
We
Thank
can
you.
work with Susan on that.
So who's getting the numbers, Senator? Oh, OFA? Has the report been asked?
I asked OFA to give us the dollars last week so that we could get that. And so I should get that this week and then put it off to the, because we could we could say, hey, listen, everything has to be funded by the general fund. So the first question that people are going to ask me, well, how much is that? So I have to ask OFA to give us what was that? How is that? So we'll get those numbers from OFA hopefully this week. And the numbers on the policies would be done by the insurance department in conjunction with Susan. So,
Okay, and
depending on which number you were asking about.
and we do know that there's 104 million being assessed every year. We just want a breakdown of that. That's what the next step is. Okay, that's what we'll work on. Chris?
Yes, and to that question of who's actually paying that assessment, I think it's important to also look at who has access to some of these programs too, because if it is socialized, is it, if it's open to anybody to utilize, for instance, a needle and syringe exchange program, but the cost is only borne by those select few that are paying for fully insured products here in Connecticut. Is that globally a conversation for, is this in the public good? And if so, then should it be paid for through the public good, which is the general fund, rather than as an assessment on a select few number of people's insurance? And I think that's something that I think this task force is charged with taking a look at and trying to figure out. So getting that information that Senator Austin's looking for, I think, is an important one to look at, but it also may be important to follow up and find out, to Eric George's point earlier, like who's utilizing these programs and what do those numbers look like as well?
And just to follow up on that, how would we get that information? I'm putting that out to the group. How would we know who's utilizing these programs?
So alls we have to do is ask I believe alls we have to do is say, so for example, just the needle and syringe exchange program gave a list of where the programs are. So we can ask, are these, like it says, Apex Community Care Incorporated. Where is Apex Community Care Incorporated? We can ask that next question. Now that we have this, is Apex covering programs in a number of different towns? We don't know that with what we have here. So we can ask that question next on the areas that they've identified. So when they did the venereal disease control, they have Bridgeport, Hartford, New Britain, New Haven, Norwalk, Stamford, and William Backus Hospital. That's Norwich. So I know that that's Norwich. So that should say Norwich, William Backus Hospital. And that way we have an idea of what cities or towns are being impacted. If you looked over at the X-ray screening and tuberculosis care, one of the largest ones is medical services, non-contractual supports. What does that mean? Where is that? But it says Bridgeport, Danbury, Hartford, New Haven, Norwalk, Stamford. And then the next one is medical services. So where is that? What is that related to? I could point out the other ones, but if it's Hartford Healthcare, Hartford Hospital, So is that just up in this region up here? Or as Hartford Healthcare owns a third of the state's healthcare now, is that in all of their hospitals? It's a question that I don't have an answer for. It says Hartford Hospital, but does that mean it's only Hartford Hospital? It's not Bacchus, it's not Wyndham, it's not any of those. So I think just having that, that expanded a little bit on where they've outlined, they've done a good job on outlining this. We just need it to open it up a bit, which will give us a lot more information.
Thank you, Senator Austin. Sue Halpin?
Thank you. And I'm sure the agencies are appreciating all our additional questions, but if we're going to add some additional questions for them to respond to, I think another one would be, what is the nature of the folks served by each of these programs? Are they commercially insured? Are they Medicaid? Are they Medicare? Are they uninsured? And I think that's what Chris was getting to with part of his question as well. And I'm sure many of the programs track that, I'm guessing. So it would be, if that is available, not looking for information that's not readily available, but if it's available to know generally the breakdown of who's receiving the services would be helpful by insured status.
And just to the extent that that's not available, maybe even age would help, age ranges might help as well.
Okay, great. Any other comments? All right, so we'll move on to number 4. We did kind of start to talk about some recommendations. Senator Austin suggested a phase out over 5 years. Anyone want to make any other recommendations, or do you want to wait for additional information? Eric?
It's not really making another recommendation. I just think it's a really, really good place to start the conversation, because it's just saying, out of the how many years on the insurance side, both P&C Life and healthcare, when talking about the insurance assessment, this is the farthest this conversation has ever gone in a tremendously positive way. The fact that we're talking about it, I think, is really advanced everything. So I want to thank Senator Austin and Representative Wood for the recommendation. I think it's a strong one. I think it's realistic. None of us are so cavalier to think that you can just move everything into the general fund 1, 2, 3. But I think a thoughtful approach is the way to go.
And I do want to say that I've learned so much about, these assessments and about, the process for kind of what we do when there are dips and turns and things with the state budget. I think in the very least, I hope we do explore this in a later meeting. We at least set the tone of like having a moratorium on future assessments. I think we have a lot of questions about what's in front of us now. And we do have a new committee that was formed, a government oversight committee, that I think we should just have that in the back of our heads, maybe utilizing the services of that committee, because the insurance and real estate committee, as well as the appropriations committee, could probably use some additional help, when diving into these types of things. So, that's a recommendation that I think we should, consider while we dive into understanding more of this. And, maybe setting a policy of how assessments are going forward, bringing forth, the plans that would be affected, maybe a per member per month pricing, a justification of, why an assessment should be placed in the insurance fund, rather than having, things just kind of appear in the budget. And then we're trying to figure out and backpedal and understand, how these were put here in the first place. I mean, I think this would help future legislatures, and it would be, a responsible budgeting policy going forward. Chris?
I think that's a great idea. The concept of a sunset of any future or recommendation that we recommend a sunset for any future assessments so that there would be that reexamination of whatever they are. Because I suspect just looking at some of these programs and just my knowledge of the state budget, a number of these have been around for a long time. And I think to the points raised earlier, I don't know how much people have been examining who's using them, how effective they are, what's their outcomes. Are they truly insurance-based costs, or are they costs that are for the general good of the public based off of the general fund? So a recommendation that all future assessments also include a sunset, I think would be an important one as well.
Sue?
I think both recommendations made by Senator Austin and Chairman Wood make a lot of sense. I think a 5-year, and I should have said Chairman Austin as well, Chair Austin. Vice Chair. Okay. I think it makes a lot of sense, a 5-year kind of phase out. I want to make sure that when we're recommending that we do differentiate between the different assessment mechanisms within the insurance fund, because I think that's really important. In prior meetings, we spent a lot of time on the Office of Health Strategy and the Office of Healthcare Advocate. And I know the Office of Health Strategy put forth a memo. I haven't had a chance to review it in depth today, but those are funded under a different mechanism, for instance, than the one for the Department of Public Health. So I want to make sure we differentiate between those two things as we recommend a phase out. I also think the moratorium is a great idea. I think it should be extended to future positions as well. Because one of the things we've seen, for instance, we've seen some of these agencies grow significantly. The Office of Health Strategy, for instance, there's been programs that have been shifted, like the all-payer claims database. I believe it was previously at the Department of Social Services and moved into the Office of Health Strategy and therefore moved under the insurance fund. Maybe that's an appropriate use of assessment dollars, but I think expanding the roles of each of those agencies needs to be looked at before it is expanded, because it can grow considerably over time. And, the Office of Healthcare Advocate, it may be a very valid, worthwhile agency and one we have supported over the years. But I think we need to, again, make sure that any expansions are warranted.
Thank you, Sue. Any other comments, suggestions, recommendations? Okay, so basically we have come to the end of the agenda. We will be collecting some additional information and we will do our best to fit another meeting in. Why don't we wait until we collect that information and then we set the next meeting? Just so that we have time to digest it. Sound good? Okay. With that, motion to adjourn? Second? Great. All those in favor? Good. We're adjourned. Thank you.